So our next question is, what kinds of programs, if any, would you support to help the homeless in Salt Lake City? We will be starting with Ralph Becker.
First of all, thanks, I think, to the great history from Mayor DePaulis, who focused attention in this city on homeless, who spearheaded the development of the homeless shelter, and with the work that's done with St. Vincent de Paul and others that are providing food services. I mean, we really have been a leader, I think, in this, certainly in this region, if not in the country, in providing for the homeless. And much has been done since then, and I think we've seen with the Sunrise Apartments that as J.P. Hughes has said so well and often in our forums, we need to provide shelter. There is no excuse in our wealthy society that people do not have a roof over their heads or food on their plates. And we can do that. We save money. And I don't want to take the words from J.P. Hughes, but we save money if we provide shelter for people in terms of the other costs to society. And the Sunrise Apartments is a great example. The city has recently been involved with acquiring the old Holiday Inn, I think it was, that's down on West Temple. And we need to provide shelter. And that is a public-private partnership. It's both government, religious institutions, nonprofit institutions all coming together and making sure that those most vulnerable in our society have shelter.
Jenny Wilson.
Well, Ralph's already mentioned Palmer DePaulis in his role. I'd also like to recognize Pamela Atkinson, who's affectionately known as Salt Lake City's Mother Teresa. But Palmer, Pamela, and other community leaders have really worked on this issue for many years. And in their studies, in their deliberations, and their ongoing meetings, they embraced a concept that I very much support, and that concept is known as housing first. And the idea being that if you look at the homeless population and their needs, there are often some challenges with their personal lives. We also often see an addiction issue, and many times some mental illness, clearly. And one of the national concept that was embraced by this group of Housing First is that if you provide people a home, 4 walls, running water, a toilet, the basic shelter for life, then the other problems will work themselves out. And we have seen not only this to be very successful nationally, but we've also seen it be less expensive than funding community partners at the level that could otherwise be funded. So we have embraced in this community that notion. It's something that we're involved with at Salt Lake County. We're regularly, as a county, reviewing how things are going within the county. And I'm very pleased, as Ralph mentioned, that we have 2 new housing units, one recently opened and one in the renovation stage and the funding stage. Sunrise Apartments downtown has been open, I think, since early April, and we're able to move the chronically homeless to this new center. That will free up beds in the Road Home and other shelters downtown for their intended purpose, which is short term. So it's finding to be successful. I'm hearing from Pamela and others that there are perhaps not enough community activities, and we need to look at that and provide some assistance perhaps at the city level with those services. I was glad to hear from the firefighters the other day who were concerned about this, frankly. They've endorsed me when we were talking about this notion, and I was glad to hear that they have not been to calls at the center. We will soon see the Holiday Inn, as Ralph mentioned, be remodeled. It's a great community partnership that I was pleased Salt Lake County was able to provide some funding for, along with the LDS Church Foundation, other good community partners. We will see more housing units and more to be done, but we're on a really good roll right now with a lot of community involvement.
Keith Christensen.
Yeah, thank you. This is a chronic problem, and I don't wish to oversimplify it, but the homeless people in our community, and really I don't want to oversimplify this, but they come in at least a couple of categories. Some are chronically ill and need help. And to that part of the population, I think we need to deal with the issue in a very straightforward way. What mentally ill individual or chronically ill individual or physically ill or handicapped individual deserves to be homeless? We as a society owe that community proper care. That's a discussion that ought to occur not just in Salt Lake City, but at the county and at the state level. And those issues we really as a society should get past pretty easily. The other part of the population, let's say they're just down on their luck. They're unfortunate for the time being. But they don't want to be homeless, and they can work. They like to work. And maybe it's vocational training. Maybe it's the kinds of things that will help them get back on their feet and restore their dignity and give them a future. And I really think we need to, where I'm headed with this, and I don't know why, we just talk in these generalities all the time. Salt Lake City needs a 10-year housing plan. And that 10-year housing plan must encompass this issue. And I don't know why we can't get to that. I'll tell you, if elected, in the first 60 days, we'll have people at the table with a 10-year housing plan proposal from the mayor's office. And that housing plan has to do with mixed-use housing. I've been to communities and looked at what other cities have done, and it works. You can mix use. You don't have to have acres of affordable or low-income housing. You can mix these projects, and we can provide good housing for real people and help solve a problem in this community that has gone on and on and on. And yes, there are marvelous people working on it today. They need our help. They need your help, my help. They need us to work on it together. And that 10-year housing plan will be the roadmap to getting it done. If you don't start today, I've learned in business, I can't build something if I don't start the plan. And then I get it approved, and then I start building, and then it gets done. It's what I'll do. If Jenny will stay on the city council or the county council, she can help me with this. And I know that I think as a group, we're all concerned about these issues. And it, again, doesn't become what you do. What you do, well, you fix it. How to? Do you have the skills and the background and the knowledge to go about it? I think I do.
John Renteria.
The homeless issue is something the city can't solve by itself. It has to partnership in tandem with existing programs available to the homeless and do more by way of sensitivity on the issue of homelessness, unlike, unfortunately, the administration that we've seen more recently in its opposition to SRO living and trying to do something about hiding the homeless away from developers like Gateway and not doing something to address the problem of homelessness, like I said. I also serve on the board of Crossroads Urban Center that deals with these types of issues. And we need to do more in terms of working with other similar programs that address the issue of homelessness, the reasons for homelessness, and some of the answers that they have. Unfortunately, like I was saying, the city can't do it on its own. We've tried in the past, and it's just one of those problems that we're never going to see go away. But we can do what we need to by way of advancing housing opportunities for the homeless, jobs, in working with the business community to help them get work, health insurance for those that don't have any health insurance, and again, community centers, activities in the community, working with the shelter, working with the homeless themselves to identify some of the issues and concerns that they have so that we are also educated as an administration to meeting those needs. I think for the most part, I guess, they have been pretty much left to the wayside, and we need to do more by way of our own sensitivity, and leadership in this administration needs to be much more aware and take advantage of working to solve the problems and working with other groups to help them.
J.P. Hughes.
The biggest disease today is not cancer, but rather feeling unwanted, uncared for, and deserted by everyone. The greatest evil is the lack of love and charity, the terrible indifference towards others. And Mother Teresa said that, and it's as true then as it was ever. We need to start being more attuned to the needs of others, the low-income housing, the homeless housing, the uninsured, and a city can work together with other entities to provide that. I went to the Malahi Clinic last night, fundraiser, second annual ball that they had. Every player in medicine was in that room, and all of the needs related to solving the problem of the uninsured were in one place around a metaphor of a single clinic on 33rd South that has seen thousands of people in the last 2 years absolutely free. And I think we need to have more imagination, more creativity, more energy that comes from the community, so we don't go to places like when we go to these forums, they stand real close and they say, what are you going to do for me? And I think the message should be, what are we going to do together? We've got this problem. What are the answers? I asked you today for the answers, and you wouldn't send them to me. And I think, we need answers, and then we need to work together. And I think we can do that with the homeless situation. Just this discussion that we've heard right here is absolutely fabulous. We just need to start somewhere and work together.